Once upon a time, there was a little boy named Darby, and when he was born, all the stars fell out of the sky, and one by one, we hung all the stars back up together. And I would tell Darby every night, I love you to the moon and back, and more than all the stars that you help me see. Darby was our son, and he had a normal pregnancy, so we did not know that he was going to have any medical issues when he was born. His diagnoses unfolded very slowly over the first couple months of his life. We didn't understand all the things that were wrong with him. When he was first born, they just thought that he was maybe a little bit sleepy and needed some help breathing at first, and then he was going to be okay. I tried to breastfeed, and he was really just sleepy, so I had a hard time with that. So we were able to feed him with a bottle. So we went home, and maybe the third day that he was home, he choked and aspirated. Bart was feeding him, and he woke me up, and I had to give him mouth-to-mouth because he turned blue. So we went back to the ER, and we put in an NG tube just to help him. So he would start his feeds, and then we would finish him with an NG tube. He aspirated again, so we went to Children's in Detroit the next time. And so we spent another week in the ICU there, and they did some more testing and decided that maybe he had some infantile spasms, and there might be a little bit of abnormality in his brain, and they were worried about sleep apnea, but nothing very definitive was diagnosed. And that's when we started seeing ENT doctors, and they decided that maybe he had some abnormality in his upper airway that was preventing him from eating and breathing at the same time. So that whole time, it was just Bart and I, and somebody was always watching him and always awake with him, and between the two of us, we would do 4-hour shifts. So somebody would sleep for 4 hours, and somebody would be awake with Darby for 4 hours. Next time we went into the hospital, we were there to stay for a long time. We did an upper airway surgery, and it helped clear up what would be sleep apnea for him. And when they put his feeding tube into his belly, they perforated his bowel, and he went septic. And this whole time, it was during COVID, so I was in the hospital with Darby, and Bart was home. He wasn't really able to be with us. When he went septic and he looked like he wasn't going to make it, Bart was finally able to come to the hospital to say goodbye to Darby if he didn't make it out of surgery. And when we made it to U of M, he finally was diagnosed with bronchomalacia, which is a collapsing of his lungs. So whenever he was in pain or would have a bowel movement, his whole lung would collapse. So he would need to be on a ventilator to support him to keep his lungs open. From there, we spent, I think, another 3 months recovering, getting stronger, and then preparing to go home. We had first day set up when I signed the DNR for them and explained that we knew the risk that we were taking on. Up to 20 times a day, we would have to take him off of his ventilator and use an ambu bag to help stent open his lungs. It's more than what is usually expected for a child on a ventilator. Usually the ventilator is enough to support them, and you don't have to do that. But the other part of that is that I had to go back to work, and whatever nurse was going to take care of Darby would also be accepting those responsibilities, which is a lot to ask for a home healthcare nurse that was going to be working independently without the support of a hospital. We had lined up first day, and I had interviewed Charity. Charity was amazing, and we had a couple days together where we just would take care of Darby together, so I could tell her all of, his little Darbyisms to watch for.
My first half hour there, his airway closed down, and Jess was reaching for that ambu bag. He's purple, she's ventilating him, and she was so calm. Like, this is what we do.
She would sometimes have to handbag Darby 10 or 20 times a day too, but she was really good with working with him. She helped me take a step back from being Darby's nurse and just be Darby's mom. So our days that we worked together, she would just tell me to hold Darby, and she would do the tube feeds, and she would do everything else for him, and that was a very nice transition. You can't do it by yourself. Like, Bart and I couldn't continue on the 4 hours on, 4 hours off schedule. You need help. It's hard to invite someone into your family and to trust them with your very special needs child, but I think that the couple nurses that we had became part of our family, and they helped us just maintain as much of a sense of normalcy as we could.
They've got the hardest thing they've ever done in their entire life. But you're stepping in and just taking a little bit of that burden off of them, giving them just a little moment to breathe.
What are you talking about? What are you talking about?
And then Darby lived pretty comfortably at home for the next year. And then we had an instance where he had a mucus plug and he almost died. I had to give him CPR on the way to the hospital. And we ended up doing an emergency trach change on the side of the road before EMS got to us. And we got him back from that. But after that instance, I also called palliative care and hospice just because I didn't want an experience where my son died on the side of the road. I wanted to be able to have an understanding and a plan for him that if he wasn't going to make it, I wanted it to be peaceful and not panicked. He got to a point where he just threw up all of his feeds and we couldn't support him nutritionally. So that's when hospice came out and we took him off of his ventilator and made him comfortable, and he passed in March, just before he turned 3. Even through all of that, our nurses from first day were very supportive, and they helped just to keep doing his medications and taking care of him so that we could just be with Darby and be his parents. I want other families to be able to have the nursing care that they need because you can't do it alone.
So special. He was a very special first patient.
He's a little angel that we will never forget, and he changed our lives